Hello everybody, welcome to the Medical Weight Control channel. I'm your host Annie Rivera and I am at the Chino Hills Clinic. I'm here with Michelle, who is the manager, and Aide, who is the regional manager. Thank you guys so much for being here.
Thank you.
So Michelle, tell everybody your role. What do you do here at Medical Weight Control?
Here at Chino Hills Medical Weight Control, we make sure our patients are well taken care of, compassion, learning how better techniques to lose weight, to stay motivated, to stay healthy. So we do our best to offer those services and provide them with better options and better ways to stay healthy and lose weight.
I'm the regional manager. I go around to all the locations, make sure that the staff is doing their job, helping out the patients and giving them the proper care that they deserve.
We were talking a little bit about resolutions, and around this time, like we said, most people make weight loss resolutions or, self-care, personal development. Now, can you tell us what are the top reasons why people seek weight loss around this time?
A lot of people have health issues, and what better time to start than the beginning of the year. So we get a lot of that here. We get more so people that first try the gym and try it on their own, and then they realize that it's a little tougher than what it seems like, so then they'll come and look for help from us.
So now, Aide, for you, because you travel from here, Chino Hills, and all the other locations,
yes,
correct? So what do you see as why people ask for expert help with weight loss?
Like Michelle said, one of the common reasons is they tried on their own and they're struggling and they need that extra help. They go to the gym, they're working out, but they still can't seem to get to their goal. So that's when they contact us, they start coming to us, and we start helping them with the medication, giving them tips on to what they should eat, what they should do. Also, we encourage them to continue working out, eat healthier. And a lot of patients, that's one of the things I see almost everywhere I go is,
they need motivation.
They need the motivation and that's what we're here for, to motivate them a little bit more. Una de las razones que miramos comúnmente en nosotras locaciones es que los pacientes batallan para perder peso ellos solos. Cuando van al gimnasio no están motivados a perder el peso. Entonces nosotros estamos aquí para ayudarlos a motivarlos, a darle consejos para poder alcanzar sus metas.
How are you able to relate with patients and their weight loss journeys?
For me, myself, I was overweight. Well, I can't remember how much I weighed, but I know I was about a size 14 when I started externing here and doing some of the programs, mostly of the lipotropic injections. Those are mainly what I would do. And I went down to a size 6 before I was pregnant with my second child. So it works. It was awesome because I've never been that small. Even in high school, I was always the big girl.
So that's how you're able to relate to patients. You can tell them kind of from your own personal experience.
Yes. So from my experience, I can tell the patients what they can achieve if they really want to. I did it. I'm living proof that it worked. So that's why I love working here, because I know it works.
For me, I can relate with patients because prior to having kids, I was on the heavy side, and fresh out of high school, you're like, okay, a lot of people say, oh, it's fine, you're young, you'll lose the weight. Okay, but you still struggle. So prior to having my kids, I was able to lose 20 pounds of being on the program. And then after having my kids, it got harder. And that's when people say, after you have kids, your body changes, everything, it's a lot harder. That is true, but with the program, I was able to reach those goals. And especially with self-esteem, you don't feel yourself after you have kids, your whole body changes. So to be able to lose the weight, it makes you feel good. And that's why I tell patients, I understand because I've been on both sides, prior to having kids and after having kids. So that's how I can relate with the patients. Yo me relaciono con los pacientes en la pérdida de peso antes y después de haber tenido hijos. Miro lo difícil que es perder peso antes de tener hijos, saliendo de la preparatoria y estando sobrepeso y pues no poder perderlo y estando en un lugar que nos puede ayudar. Es algo que nos es fascinante, perder el peso y tener la motivación de personas que los ayuden. Y después de tener mis niñas, también la pérdida de peso que no podía yo sola. y eso me ayudó bastante venir trabajando aquí con esta clínica.
So here's a really good question that I was curious to know. What nutrition advice do most people ask here?
Oh, there's
A
a
good
lot.
one. A lot of that.
Right. And so from experience, from what you can see, do they have trouble maybe, with snacks or, high carbs, or
Everything.
it's across the spectrum, right?
Everything.
Yeah.
Yeah. From alcohol, what kind of alcohol can I drink, or can I drink alcohol? I get that a lot. Fruits, what kind of fruits can I have, or what time fruits are able to be consumed?
I know carbs are a big one. A lot of patients are, how do I stop saying no to bread, especially during the holidays, or we're going out this weekend, they're going to have dessert. How do I say no to that, And my answer to them is don't.
Yeah.
Just portion yourself. Eat less of what you would normally eat. Treat yourself, because you still deserve to treat yourself. You shouldn't basically seal yourself from not eating anything. Uno de los consejos que muchos pacientes piden o nos preguntan es cómo puedo decirle no al pan, a las tortillas, a los carbohidratos, porque eso es algo que está todo el tiempo. Está en los postres, está en la comida, en las pastas. Entonces nosotros, lo que yo les recomiendo es no le digan que no, coman pero en menos porciones. Controlen su porción de comida para que puedan seguir comiendo estas comidas.
Hey everybody, I am here with Maria. Maria, what do you do here?
I'm a registered nurse. I actually do laser treatments. I help patients basically lose weight, put them on a program, basically assess them, make sure that the program's right for them.
Now, besides weight loss, which we talked a lot about earlier, tell everybody what other options do you offer here?
Well, with the laser treatment, we offer laser hair removal. We offer actually a skin tightening program, or I should say treatment. It's called Tighten. It helps basically tighten up the skin. It will go ahead and stimulate collagen, basically tighten up the skin around those areas. We have another one that's called Laser Genesis. Laser Genesis basically will actually help smooth out skin, shrink down pore sizes, basically reduce scarring, stimulate collagen also. We also have another program or another treatment with the laser that's called IPL that gets rid of kind of dark spots, basically kind of lightens up some of the skin areas. And then we have another one that's vein therapy for spider veins that helps eliminate or basically reduce the appearance of veins, of spider veins.
Now, what do you see most patients ask for, or how do you differentiate some of the things that they're looking for, and what do you recommend?
Well, a lot of patients actually are right now interested in laser hair removal. We actually do a lot of laser hair removal options. You basically from your face to your body, everything. We do see a lot of that. The other thing too is laser genesis. It's very popular because it's very cost effective also. We've noticed that a lot of people see a difference between maybe 4 and 6 treatments of doing this, that their skin looks younger, collagen is basically being produced, you get that more youthful appearance, reduce basically like fine lines, pore sizes, and people really like that one too.
Now, you mentioned Botox earlier. Can you talk a little bit about that?
We actually offer Botox. We're offering it right now every Friday. We do plan to in the future offer it, multiple times per week, coming up shortly, probably in the next couple of months. But yeah, we offer it basically in the glabella area, the frontalis, crow's feet, a little bit of lips. So basically whatever areas that, patient finds that's bothering them, we'll go ahead and assess them and then basically treat them and give them a kind of a plan of where to go. A lot of patients come in here, they've never had Botox ever in their life. They're a little bit nervous about it. We educate them as far as basically the whole process. Normally they'll have it done maybe 1 or 2 little areas and then they basically love it and they'll want to come back after a month and get more. Basically when you see the results, they're sold.
So, and you educate patients?
Educate patients, yes, of course, as far as, basically how it works, what to expect, some of the little, not much downtime at all, maybe a few hours or so, maybe a day. And you start to see results basically within 7 to 14 days, and the effects can last up to basically 4 to 6 months. Great. So depending on, of course, the person. But yeah, during that time, patients love it. They do it the first time. They'll come back for 2nd, 3rd, 4th, 5th, and on, as far as continuing the treatments.
Could you share some success stories? And without naming names, we don't want to name names, but without naming names, could you share a success story that you know about that was, worthy of celebration?
Oh, we have a lot. As you can see when you come into the clinic, most of the clinics that we have the photos of patients befores and afters, and some are awesome. Some are amazing, up to 80 pounds I've seen or more in a few months. Some do it naturally, which is even more better than with the phentermine or phentermine, which is the chemical. Some do it with lipo injections, with the fat burners. They just are motivated and exercise and eat right. So you see anywhere from 15 pounds, which is an awesome story, to 80 pounds.
And so, Aide, you go to all the locations, not just Chino Hills, but what do you see in terms of success stories?
You know what? Success starts from even losing a pound.
Mm-hmm.
So
Yes.
for patients that even lose a pound, it's, they're happy. As long as they're losing the weight, that's what their main goal.
Right.
And that's what we're here for, to help them reach those goals. There's been family members of mine that have been in the program and have lost over 40 pounds. And, and they're happy. And that's what we're here for, to help them reach the goals. And we have patients everywhere, as long as we're helping them, they're losing something, it's either inches or weight, we're there to help them. Muchas metas que he visto que los pacientes han alcanzado comienza con solo 1 libra. Con que pierdan 1 libra es un principio, es algo, ya una ganancia. El chiste es perder algo y no subirlo. Y para eso estamos aquí, para ayudarlos a alcanzar sus metas y perder el peso que necesitan perder.
So everybody, you can come check out Michelle and Aide here at the Chino Hills Clinic. And Aide, as she says, is a regional manager, so she's in different locations as well. But you can certainly come on by, check them out, and you can also check them out on social media. We'll have all the links down below, so don't forget to click around and check them out. You can find them on Instagram, Facebook, and on their website. We'll have all that information for you down below. Thank you guys all so much for tuning in. I'm Annie Rivera. This is Michelle and Aide. We're at the Chino Hills Medical Weight Control location. See you soon. Bye.
I'm Aide.
And I'm Michelle.
And we're here to help you reach your goals.